Today on the show, the value of relationships in the cancer care community. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. You're listening to the 7th and final episode of our international series. You've heard from the experts in cancer care who spoke at the global panel discussion during the ACCC 41st National Oncology Conference. Today, we speak with Dr. Christopher Steer, who joins us from Australia.
So the care of patients with cancer is a global issue, and coming to meetings like this will be extraordinarily important so that we can learn from each other. From my perspective, organisations such as the ACCC and the people they represent, the carers that they represent, physicians like myself, this is where the work of looking after our patients with cancer is done in the community. It should be more of it in the community, in my opinion, where we're bringing care closer to our patients. But organisations like the ACCC and meetings such as this are vitally important so that we can learn from each other about how to care for our patients.
What are the most significant oncology challenges for you in Australia?
So I'm a medical oncologist working in rural and regional practice, in private practice, and there are many challenges to providing optimal care to the patients of our region. I try not to think of the fact that I do live in a rural and regional area as a disadvantage, because I try to think that all the patients, whether they live in the cities or the country, are the same, and certainly the malignancies they face and the challenges they face are often the same. They are heightened by the fact that my patients live in the countryside, but often those issues are systemic. So, first of all, there's the issues of delivering care to the regions, which can be more challenging. And one of the reasons for that is workforce. I think in Australia, I'm sure like we are globally, we are finding challenges of providing this care because there's not enough people to do the caring at every level. And I see workforce issues currently as one of the biggest problems that we will face looking after our patients in the decades forward.
Expand on choosing between oral and intravenous medication.
Yeah, so in my opinion, I try not to use different medications just because of someone's postcode, just because they live a long way from the cancer centre. You need to individualise your care, sure, but do not assume that the patients will not travel. For a time, it's how I've heard it said that the patients who live a long way from the treatment centre should take an oral medicine. It also is said about older people should take an oral medicine because it's easier and because it's a tablet. Well, in that particular circumstance, it certainly isn't. Sometimes it's more toxic and it may not be the right thing to do. So I think you shouldn't just assume on the basis of where people live and whether their inability to travel. You should give them the best treatment, regardless of what it is. At least discuss it with them. And if you think that there's a better treatment that they may not want to travel for, ask them, because they actually might. Similarly, with what we call financial toxicity of the treatment, where people might have to pay for a medicine and they've learnt that it's the best thing, but they can't afford it because the government or the insurance companies won't pay for it. You do need to have that discussion with them. Don't assume they can't pay. There might be an ability to do that. Adequate assessment yields appropriate treatment. Ask the patients, personalise your care, and that'll give them the best care.
What are the things that you're advocating for?
In Australia, we have a universal healthcare system. It's a largely public health system, but 40% of the patients have private insurance. But the private insurance in Australia only pays for hospital care. It does not pay for medications. So the high costs of cancer therapeutics are not covered by anything really apart from subsidisation from the federal government. So that means that health technology assessment of the cost effectiveness of these agents is, well, a vital part of gaining access to these drugs. The government will not pay for the high cost medications unless they are shown to be cost effective. And quite frankly, there are many medications that the people in the United States can access that we cannot dream of in Australia at this time. there is a need to continue to advocate for that access to medication specifically. And we're currently going through a process at a national level where we're trying to advocate for an interim cancer drugs fund, which recognises that these drugs are going to be funded in the future anyway. Let's just bring that forward by a significant amount of time until it gains regulatory approval in our country. So we are currently advocating for that. Those kind of things are what we do to bring better treatments for our patients in Australia.
What would you like your colleagues to take away from this conversation?
Just in terms of advocacy, you have a voice, a strong voice. The patients have a voice for politicians and decision makers. But I strongly feel that it's important to advocate for improved care, because unless you're at the table, you're on the menu. And appropriate advocacy, respectful advocacy, is important to get the job done.
Thank you, Dr. Steer. This episode concludes our international series where we've learned how oncologists across the globe are enhancing cancer care. But that's not all there is to learn. Follow this channel so you don't miss out on more episodes. Thank you for listening. Until next time, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.